What's going on? Welcome to another podcast. I have a really cool guest today. Unfortunately, it's a very short podcast, but definitely was a pleasure to talk to Larry. So if you haven't heard of him, Larry Campbell, he originally started, he was in the RCMP, specifically on the drug squad, RCMP being the police force in Canada. If you're not Canadian, you might not know that. He went on from there to become a chief coroner in British Columbia, and then went on to become the mayor of Vancouver. So when he was the mayor of Vancouver, he was very much a big advocate for harm reduction practices for hardcore drug users. Very much involved in getting things like needle exchange programs going on in the city, and is now currently on the Senate of Canada. So definitely, I was pretty excited that he even chose to talk to me at all. Let me ask him a couple questions. I'd love to talk to him for longer in the future. But in this one, we just talk a little bit about drug policy and what could be changing in Canada. And, specifically with marijuana and how marijuana could be changing legally by next summer. Very exciting, pretty cool. And it's just cool to hear from someone like Larry, who is operating at that high level of government and who is, he's on board for changing some things in this regard. So very cool. Pleasure to talk to Larry. Check it out. This is me with Larry Campbell.
For the last, 30 years, I've been fighting most prohibitions because I think that they're counterproductive. And especially, let's start with marijuana. I mean, there are highs and lows to marijuana without putting too fine a point on it. But certainly, putting somebody in jail for possession of marijuana is ludicrous, and I think that the federal government has come to that realization, and we're going to see that change rather rapidly. I was quite surprised to see the U.S. beat us to it, that they got ahead of us on it.
Right. Yeah, everything I've heard sounds like that could be coming down the pipe here, and maybe even in as early as this coming spring, that marijuana could be changing legally here.
I think that's within the time frame, spring to summer. What those regulations will look like, I'm not sure. Certainly, along with everybody else, we want to protect those who are under 18.
Right.
But in saying that, I also recognize that teenage years are years of experimentation and years of learning. And so, like many other things, tobacco and alcohol, some of this comes under the learning process.
Right.
I'm much more excited, actually, about having it legalized so that we can go into it from a medical point of view and determine exactly why this works in all different kinds of ways, from aches and pains to pain relief to sleeping. I mean, it goes on and on.
Right. As far as the benefits that it hasn't been able to be researched very much is part of the problem as well.
Never been researched because it's been illegal. I mean, our best research comes out of Israel.
Right.
But I think that will change, and more I'm speaking to different people in Canada who are aligning themselves with science, aligning themselves with universities, aligning themselves with research agencies, and I'm incredibly excited. I think that this could be the aspirin for the new millennium.
Right.
With regards to other drugs, I along with many others brought into play the first supervised injection site.
Right, in Vancouver.
And I think that as I move along through this transition, I actually have started, along with some other people in the Senate here, I started thinking about, with the way things are with fentanyl and with the rise of opioids and other drugs that are being synthesized, perhaps we should be looking at actually prescribing those drugs within the parameters of a supervised injection site. The interesting thing is that many people object to a supervised injection site for the very reason that the drugs come from the street, and we have no way of knowing what they are or what's going on. These same people that fight on that will agree to supervised injection sites
Hmm.
with the proviso that we actually do prescription, which
I
uh,
see.
is quite amazing. I mean, it's and it makes sense to me. Um, what the government will do from that point of view, I don't know. But certainly, um, to understand any of this, you at least have to start from the basic premise that addiction is a medical disease,
Right.
that
Yeah.
it's not a character fault. Um, and the reasons for the disease are many and varied. They range from, for instance, abuse. They may arise from a lack of self-worth. They may arise as an accident. In this experimentation that I spoke about, sometimes you do things with consequences that you're not aware of. And I think that those are pretty rare. I don't think that somebody cranks,
Hmm.
injects, and then suddenly becomes addicted. Most of the people who are addicted that I know, and there's thousands of them, there's an underlying cause. But nevertheless, essentially what they're doing is self-medicating.
Right.
They,
Yeah.
they hurt, and just for a period of time, this takes the hurt away,
Yeah.
and they get addicted to it, and then their whole life changes. Everything that they do is predicated on getting the drugs, and
Yeah.
so
That
we end
causes
up.
crime and all these other things.
Well, it's it causes crime in that, but it also causes huge harm to people. I mean, the crime. Most of the people, most of the crime that we see in the newspapers, the shootings and break-ins and all the rest of it, these aren't addicts. These are criminals.
Hmm.
These are people who are probably selling drugs.
Right.
Then they're not selling drugs to support their habit. They're selling drugs to make money. Lock them up, throw away the key.
So
I
do you
think
believe on some level then to regulate all drugs that are currently illegal in some form, and maybe it has to do with prescriptions and maybe it has to do with different sort of regulations and policies, but in some form not having people be criminals for using drugs?
well, this has been an evolution for me. I mean, my background was as a drug squad officer with
Right.
the
Yeah.
mountains. So for the longest time, I had to fight that everything should be legal. I still am not. I have difficulty seeing why I would make chemicals legal,
Mm.
except for in the case of using them as a treatment.
Mm.
And so, for the most part, people who are addicted, the toughest part about it is how they have to live. They never can relax. They're being chased by police. They're being chased by other addicts. They don't have an income, and so one of the interesting things, there was a study done in Vancouver where they gave addicts uh, prescription drugs,
Right. Yeah.
and it's quite amazing because once you take out all of the life's travails, all of this, all of the anxiety and all of the
Yeah.
stuff
Right.
that goes on, they get a place to live. They get a door that they can lock, and they start looking and saying, "Gee, yeah, they're eating healthy. They're looking better." They start then going through the process of what am I doing and how can I get help here?
Right.
And from my point of view, who cares? Does anybody really care if somebody spends all day watching Oprah instead of selling themselves in the sex trade,
Mm.
instead of doing petty crime, breaking into cars? Does anybody care? No, because from
Right.
society's point of view, they're not causing me any harm, and it's costing me virtually nothing to
Right.
do that. So, um, like, I can't imagine any of these drugs being described as recreational, except for marijuana. I really
Mm.
can't.
I see what
But
you mean.
that's my bias. That's my feeling on it. But at the same time, we shouldn't ignore uh, the fact that we can help people by making drugs available.
And So, would you consider yourself in the minority as far as senators in Canada, your peers? Like, are you one of the only ones who is up for sort of changing some of these laws, or are there many other people who are also have similar kind of thoughts?
I think if I sat down with the senators, the majority of them would agree with me.
Is that right?
For different reasons. I mean, some of the idea, for instance, of it being acceptable to have prescription drugs prescribed in a supervised injection site uh, came from somebody other than a liberal
Mm,
uh, in the Senate. And so, and because remember, I always say, look, there's two reasons of looking at addiction. One is that you care about people, that they're
mhm.
human beings, that they're somebody's son or mother or daughter or whatever. The other one is, you actually do care about people, but it's sort of their fault that they're in there. And so then I switch over and say, okay, do you know how much money a taxpayer can save
Mhm.
by regulating and doing the proper treatment for people with drug addiction?
Yeah, right.
It used to be when the HIV epidemic was spiking, we were talking $250,000 a year for one person with HIV and treatment. Now, I'm
Wow.
sure that that's come down, but if you take a look at the police costs, the court costs, healthcare costs, social service costs, the cost just to your environment, to your city,
Yeah,
and I can take care of that,
right. Yeah,
and and allow people to move for treatment. It's alcoholism is addiction, and we recognize that you never get rid of an addiction. You never cure it. You go
right.
into
It's always
long
kind of there in a
you
small
go into
way.
long-standing remission if you treat it and handle it right. So, um, and I think the majority of Senate, I mean, these are good people,
Mhm.
and I think the vast majority of them would agree with me.
Yeah, even if yeah, like you're saying, even if you don't necessarily have a lot of empathy for addicts, and some people
Yep.
don't, there's still a lot
Yes.
of reasons why it would benefit our communities to change some of these laws.
I put out the proposition of just imagine if we treated addictions in a proper way, how much more money would be able to go into the healthcare system for
Right.
old people like me.
Right. I mean, there's so many services that people do access and use when they are in these states.
Yeah. So I mean, it's a win-win all the way around from my point of view.
Right.
And you know, to be skeptical, can it get any worse? Like there's 600 people died in my province in British Columbia this year. 600. When I was chief coroner, we
Mm,
were in a panic at about 250.
right. Yeah, it's
We
because
were
this
in the
fentanyl is hit.
in the 90s. I mean, that's why we started Insight because we realized that our HIV was going through the roof,
Hmm.
but we were also seeing a huge, high quality heroin flowing in, and now we're at 600. And I mean, across Canada, we're talking thousands of people.
Overdosing.
If, if this, imagine, and I hate to use any other analogy, but we spend paid more attention and spent more time on a virus from a mosquito in a country that wasn't even ours,
Right.
where we're losing thousands of people. Let's put this in perspective.
Yeah. It's an issue
You
that
know,
gets ignored and sort of brushed over a lot.
it's like, oh, they're junkies.
Yeah.
No, they're my kid.
Yeah.
They're
Yeah.
my mother. They're my father. They have a family. And for some reason, that broke apart. And none
Right.
of us know the reason, but we should be taking care of the person. Again, warm and fuzzy
Mhm.
or straight fiscal. Take
Yeah.
your pick. Doesn't matter to
Right.
me.
Yeah. So so I know we're already sort of running out of time here, but one thing I'd like to ask you is, like someone like me, I agree with what you're saying, and I agree with just that the simple fact that we need to change some of these laws, and exactly how they change, I don't know. But there's a lot of other people who agree with us too that these things need to change in some way. And you're in the Senate and you're sort of advocating for this stuff at that level. I wonder if you have any advice, or if what can people do, what can the public do, maybe someone like me, what can people do to advocate for this change and make things sort of happen a little sooner here? What can the public do?
Well, for for drug policy and insight, Mayor Owen in Vancouver just started having meetings.
Hmm.
Low threshold, come one, come all, and there's some pretty great meetings because it brought both sides of the equation into it. I think public knowledge, public understanding, the most powerful group of people that I ever met are always family and parents of people with addictions who have formed groups and have gone out. I think that as a society, we are changing. I mean, I think that we're seeing for instance, for instance, supervised injection sites are going to be a part of the landscape. We're going to have to get rid of some of the rules that the previous government brought in, which effectively shut them down. I mean, it was a backwards way of doing it.
Yeah.
But once those change, these are going to become more and more. They're going to be cancer clinics. They're going to be diabetic clinic. I mean, that's all they are. They're simply a healthcare facility for people with drug addiction.
Right.
And so I think, and also I think that people more your age, younger people have the communication skills. I mean, like I've never been on Skype before. I mean, I know there's people out there laughing,
right.
but I come from a different age, whereas you have access to. I don't tweet. I'm not on. Well, I'm barely on Facebook, but you understand all of this,
right.
And from that medium, from that ability, you can get to virtually millions of people on this. And I think that's critical. It's the education part about it. My word to everybody is, if you've ever met an addict, do you ever imagine that addict saying, boy, am I ever glad I'm an addict?
Yeah, absolutely.
I mean, that's the bottom line. Do you think that anybody gets up in the morning, has to go sell their body or has to go do something illegal, and they're saying, boy, what a great day? It just isn't like that. And
No.
people have to stop thinking that they're doing this for pleasure. They're doing this to kill whatever pain they have.
Yeah,
It
absolutely.
may not be the great way to do it. It probably is not the smartest way to do it. But nevertheless, that's what they're doing. And we need to help them because they can't do it on their own.
Right. Yeah, I agree. Yeah. Well, I know we're pretty much out of time. So
I can hear the bells ringing in the background calling me to the Senate. So.
All right. Yeah. So thanks a lot for the time today. Thanks for the work that you're doing. I really appreciate someone like you being an advocate for this stuff.
Thank you very much for having me.